expected of them.
Thank you so much for joining us. I am Rotimi Akintole. This program is sponsored by Integrated Communication Services, and it's designed to encourage moral values in our society and provide possible solutions to societal challenges. Today, we're talking about monkeypox. According to a recent tweet from the Nigeria Center for Disease Control, that's NCDC, this year Nigeria has recorded 277 confirmed monkeypox cases across 30 states. Nigeria is one of the countries in Africa where this disease is endemic. And today we're going to be talking about the causes, the symptoms, prevention and treatment. We're going to be looking at how we can prevent ourselves from this monkeypox disease, and of course see other issues surrounding this disease. Thank you so much for joining us. I have in the studio with me a public health specialist, Toluwalogo Oshotokun. Thank you for joining us.
Thank you. Good morning.
All right, I have a doctor of medicine. I call her Dr. Chichi. Chidima Wokoro. It's good to have you again.
It's good to be here.
All right, so we get started with disease control. Of course, over the years, you've seen what NCDC, the government, and some other organizations have been doing when it comes to sensitization. How would you rate the level of disease control in Nigeria? Let me start with Dr. Chichi.
Okay, I think we've been doing well in later times. The only recommendation I have is that it should be more proactive. So we shouldn't wait until the disease is rampant and then you're trying to control. We shouldn't be reactive. We should be proactive.
Okay.
Get ahead of it. That's the only issue.
All right. Some people have said this monkeypox, they haven't heard so much about it. You are a public health specialist. Most of the time, from what I know, public health persons want to inform people about diseases they should be aware of. What's your take?
A lot of people do not really know about monkeypox. We're just coming out of COVID, but they don't realize that there's still COVID. Then also monkeypox, they think, okay, it's just one rash on the skin, but they don't know that monkeypox is a very serious infection, a disease. But it's mistaken for smallpox most of the time because it looks like smallpox on the skin. But NCDC, CDC, they've been trying to create awareness by doing motor sensitization for people in the marketplaces. More of that will come up, but they're still doing it right now. So thank you.
Okay, so let's get started with monkeypox as it is. Anyone that hears about monkeypox, the first thing that comes to your mind is monkey. Yes. And let's find out what exactly is monkeypox. What from your end?
So monkeypox is an orthopox virus, right? It's a pathogenic disease.
Let's say that again.
It's an orthopox virus.
Orthopox, okay.
Orthopox viruses are diseases that are transferable from animals to man. They are zoonosis diseases. So if you have contact with squirrels, monkeys, like rope squirrels and tree squirrels or rodents, that's rats.
Okay.
They are the major carriers of monkeypox disease, and monkeys, pirates. Sorry, pirates.
Okay.
So they carry monkeypox diseases.
Okay.
And if you have this right now is not the right time to eat bushmeat. You can't.
I was going to talk about that. Yes, for those who live in the rural setting, in the rural places, so to speak, in the villages, and that looks like that's their major means of feeding, so to speak. But what do you think for people like that? Is there a way out for them? Is there an alternative for people in those places, in those villages?
Well, I think the important thing is for them to cook their food properly. Monkeypox is more rampant in tropical regions, near rainforests, in rural areas and all that. of course, it's more common now in the urban states, but it's mainly a rural disease. And that's mainly because rodents are the main carriers. They're everywhere. They come into our house, they go back into the forest. So if you cook your meat well, and then know of the symptoms of monkeypox, those two things can help with
Okay, now remember in my introduction I talked about the confirmed cases. This is something I saw on the the Twitter page of NCDC. What came to your mind as a public health specialist looking at the number 277 between January and now?
Okay, what came to my mind as a public health person was right now it's not as rampant because that's just less than 3%.
Okay.
So people would not be phased right now. They'll be like, okay, it's just at least COVID, we're fine now. COVID has ended. People sometimes they say wear nose masks, they're like, COVID has ended now. And I'm like, no, it's not ended. You just need to take preventive measures and monkeypox as well. It's not as rampant, but at least, as you said, it's around the forest area. So people that live in the rural areas, they are really affected.
Yeah, but the fact that it can be a man-to-man, it can be transferred from one man to another, animal to man, environment to man, isn't it? What do you think about that? Don't you think, despite the fact that, okay, we are in an urban environment, can't we be affected? You know, people migrate. People will migrate from the rural places. So yes, every day people come to Lagos and some other states. So what's your take?
I think that's one of the reasons why it has skyrocketed. World Health Organization states about 200 confirmed cases since 2017.
Okay.
And then all of a sudden we have this massive jump. You can, when you see things like that, you look at the urban areas. There's overpopulation. People are in close contact with each other all the time. There's a lot of local food outside, and then you can't really regulate everyone. So that jump, I think, is mainly because of human-to-human contact more recently. So we can see that a lot more people are coming, from rural areas into Lagos. We can see Lagos itself alone is so overpopulated now, such a short period of time. So I think we need to look at ways that we can prevent human-human contact, human-human transmission, in order to prevent this from becoming another COVID.
Okay, but yes, another COVID, because I was going to come to that. But let's look at monkeypox. What does it look like? How do you describe monkeypox for a layman?
Okay, for
somebody who doesn't have an idea.
You can just say monkeypox is something that looks like advanced rashes. Like it's bigger, it's more visible than rashes, so it's bigger than rashes. Or you can say chickenpox or smallpox. So it's big, it's either on the face or the neck or the arms and under the palm and under the sole of the feet. So you can know.
All right. Now that you understand what our transportation system is. Yes, the public buses and all of that. What do you think? Do you think this can, in a way, contribute to increased cases of smallpox? Especially talking about sweat. Can it be transmitted by sweat?
Yes, it can.
Okay, let's really talk about how it can be transmitted, man to man.
Okay, so man to man, you have respiratory droplets. It can be transmitted from that. So if you're on the bus, you are in close proximity to each other. The conductor is shouting one thing, your neighbor
the next bus stop.
So it's transmitted through that. It can be transmitted through sweat, like you said, through mucous secretions, and close skin-to-skin contact. It can even be transmitted from contaminated items. So one person uses a towel, another person uses it. An affected person lies in a bed, another person lies there. They can get affected.
You want to add something?
Okay, I was going to say it can be transmitted from blood too.
Okay.
And also your spoons, using spoons with the same person, using sharp objects and razors can get monkeypox from there as well.
All right, you can be a part of this program. You can drop your comments on our socials, Instagram, Facebook, and Twitter platforms. That's at your viewpoint. We're talking about monkeypox this afternoon. We're talking about the causes, the symptoms, preventive measures we can take, how we can protect ourselves and all of that. Now, let's look at this disease compared to other ones. You mentioned rodents the other time, and rats, rats are like pets now. Like unwanted pets, so to speak, or something you can't just do without. Yes, so we have them every now and then. What can be done? Do you see, apart from, because from research, at the time, those who discovered this monkeypox were saying that, okay, it was discovered from monkeys that were kept for research.
Yes.
Later on, they were able to find it in humans. Now they're looking for a name, okay, another name, so to speak. So it's not just about what you find in monkeys, as it were. So what can we do when we talk about rodents? Is it possible that it's something, remember Lassa fever. But first, let's look at the difference between this monkeypox and Lassa fever.
Okay.
What would you say is the difference? Remember Lassa fever, they mentioned rats as the major cause. Yes. What's your opinion?
I think monkeypox is quite similar in its clinical presentation. Okay. If you are looking at similarities, monkeypox is closer to smallpox, chickenpox. Okay. A person gets Lassa fever. A person gets monkeypox.
Yeah.
They have fever. They have intense headaches. They have back pain. They have fatigue. But malaria can present like that. Smallpox can present like that. Chickenpox can present like that. Okay. There's one thing that they do have, and it's what we call lymphadenopathy. Okay. They have swelling of the lymph nodes. Lymph nodes are like almost like army bases in the body. So you have the defense system, the white blood cells, there are different types, and then there are different points in the body where if an infection is near to that area, more white blood cells are sent there. So because of that, it swells. So you have lymphadenopathy, and it's something that differentiates it from smallpox.
Okay, and now for those who do not understand that language, that's technical jargon, so to speak. Yes. What you're talking about is what people see now, the pictures. Of course, some persons must have seen the picture, would have shown you that picture there, where you have something like, you have pus. Yes, and it's swelling on different parts of the body. In fact, there was this video, that man, had a lot of it on him. You can imagine. So that's what you're talking about.
No, I'm talking about the swellings. They're just different swellings. They come at different points in the body. But then, when the fever comes, about 3 days after the fever, you then start having that. So it starts as flat lesions, almost like flat pimples, then grows a bit, then becomes raised, then you have clear fluid inside, then the fluid becomes yellowish in color, then it starts to dry and crust, and then falls off.
That's a lot of levels, so to speak. But the challenge now is that most people will not believe they have monkeypox until it gets to that stage where they have those swollen things on their body. What do you have to say to them?
Okay, so I think the important thing is education. We have to take care of ourselves, okay? So if you understand the way, because it's so similar to so many diseases, if you understand the way that it progresses, you have a better idea when you see it in someone. So if you have those symptoms, those early fatigue, pain, all of that, and you have that swelling, you have swelling in different parts of your body, you'll be like, oh, maybe this could be monkeypox, so let me stay away from people, let me sanitize more, let me wear a face mask, let me, use things for myself I don't share with the rest of the family. And then after a while, you start seeing those pustules, the way I said it, almost like flat, is growing, water, colored water, and then crust.
I don't think they should get to that level before you do something.
You don't get to that level.
Okay, as a public health specialist, people don't take caution anymore. You were talking about washing, sanitizing, and all of that. People seem to have forgotten that these things are important until COVID-19 came, and everybody got serious about it, that, nobody wants to die. We talk about heaven every day. We want to go to paradise. But what's your take about sanitization, or how to prevent it, so it doesn't get to that level we're talking about?
Okay, that's what she said. Sensitization comes into play, awareness comes into play. You need to make people understand that washing of your hands is really, really vital because you cannot see the microbes on your palm. So you need to wash your hands. That's at least like 70 to 80% of disease prevention. You need to wash your hands. You need to let people know they have to cook their foods. They have to keep their environment sanitary so rodents are not rampant in their area. Things like that. That's also the federal government should emphasize that Loma should keep packing dirt because of late they keep saying, oh, diesel fuel, diesel prices, blah blah blah.
Exactly what we talked about in the last episode. We talked about healthcare waste management, and we're able to touch waste management, and we talked about things like that, how it can affect us as a people. All right, but don't forget, the other time she talked about, we mentioned sweat. Even if you've washed your hands and all of that, I think there's a need for the government or the transportation people in charge of transportation to do something about it, because some people just raising their arms like this can cause serious disease. You know what I mean? All right, we have to go on this break and we will be back. There's a story about a Nigerian driver. This man is of age, but then we want to find out whether it's about passion or just to survive. Let's see the story about this Nigerian driver. We will be back after that break.
Nigerians are known to be very industrious. They have learned to adapt no matter the economic challenges of the country. Despite the hardship, Nigerians have found legitimate businesses to fend for themselves. Let's see one hardworking Nigerian's relentless effort, who, irrespective of age and several other challenges, strive to make ends meet through his driving business.
My name is Akinsola Akinbolari. This work now is not my work before. I just start when I come to Lagos. I don't see any work to do. That's why I just start this work to manage it. But as I manage it up now, so I just continue. I'm an operator of grinding machine. I enjoying it before, but now the people who are collect money, they are too much now. Because Sagbero people, they are many collecting money, do everything. Anyway, as I'm a old man now, no collect money too much from my hand. This driving now, I want people, if I can see, this motor is not my motor now. If I can see somebody can help me. It's okay. I enjoy it now. I enjoy this driving, but no money inside again like before. Because this work now, so no passenger like before, no money like before. If you know this work now, if you know try to hard the work and do hard and well, you can't see money to go home. But if you hard it, you will see money to go home. If you know and do it well, you can't see money. You must work well.
He further emphasized on the need for Nigerian youth to learn a skill or start a legitimate business in order to be financially independent. As he says, an idle hand is the devil's workshop.
I advise to them, if they can work hard, so then we see money, because young to young, because all these people who are working together, they are young. I myself, I don't hold on, but that young people, if they can hold and do this work, then if they can try it, then we see money inside. This is my work. I enjoy it. So if the young people can like to handle this job like this, we enjoying it and we have happy inside now. So that's why I want to introduce this job to any small boy who like this job. You will shop inside and feed your wife, feed your son inside. So this work is good.
It is no doubt that Mr. Akinshola Akinfolarin is one of the many hardworking Nigerians in the country trying to make a honest and legitimate living as a bus driver.
Thank you so much for staying there. We're still talking about monkeypox on Your Viewpoint this afternoon. I have Toluwalogo Osuntokun, a public health specialist, and of course Dr. Chidima Nwokoro. And we're still talking about issues surrounding monkeypox. We've talked about what you need to know, what you need to observe, the signs. But then we'd like to emphasize there's a need for us to look at the symptoms. Now, most people would think they have malaria, which is what you have talked about. So we need to really differentiate between malaria and monkeypox. So you have headache, you feel tired and all of that. How do you get to know before it gets to that level? Yes, that bad part of it, yes.
So it's those few symptoms that I mentioned. A lot of them are still not specific. That's
specific, okay.
But between within the first 5 days of receiving being infected, you have those headaches, but the headaches are intense. They're quite intense. You can have that with malaria, but not everybody has an intense headache. Yeah. Okay. And then that lymphadenopathy, you just notice that it's just irritating you here. And when you touch it, it's like there's a ball. There are different balls here.
But you know sometimes when you have flu or cold, you could have something like that.
Yes, but it's more.
Yes, and in a way, it has a way connects with your eardrum or something.
Yes.
And you feel that pain. Sometimes you have a sore throat.
Yes.
So how do you differentiate that? How do you know if it's different?
Yes. You just have a lot more of that swelling.
Okay.
So now if I have a sore throat, if I have a throat infection, I'm going to have lymph nodes around here, around here. If I'm having sinuses or ear infection, I'll have lymph nodes around my ears, around this area. Okay? But when you're having it in multiple places and they are bigger than normal, and they're growing at a faster rate than normal, then you're saying, this is not just any regular.
Or is it just about that region, the head region? Or
that's
some other parts of the body?
It can be all over your body. You have lymph nodes at different parts, under your armpits as well.
Okay.
The way you have blood vessels, you have the whole lymphatic system. It looks similar to that. So you have those swellings in many different
places. Are there differences when it comes to children, teenagers and adults? On older adults, how it affects them? Yes.
It tends to be worse with children. So it tends to be more severe with them. You know, you have more of the complications where you can have it affecting the throat, where you can have it affecting the eyes, even causing vision loss and all that. That's more likely with children, which is why we have to be very careful, because if you get it and you bring it home, your child is not going to know all these things. He's not going to have the same education that you have with preventive measures, right? So you have to stop it from even getting into the house in the first place. Okay, so it doesn't have fatal consequences.
You want to add something, Toluwalogo?
Okay, so we need to be careful with our hygiene, especially around children, because their immunity is not that boosted. Children children below 8 years old, you need to be very careful, because they're the ones that can be really affected with the monkeypox virus.
Okay, you didn't mention pregnant women. Yes. So what can you say about that?
In terms of pregnant women, there are two important things. First of all, when the woman is pregnant, her immune system is a little weaker. Okay. So she's more likely to get infected and is more likely to be more severe than a normal non-pregnant person. That's one. Two, if a pregnant woman is infected, there's what we call the vertical transmission. So she can actually transmit it to the baby while the baby is in the womb. or she can transmit it to the baby within the first few moments of life, because she's going to breastfeed, she's going to hold her baby, she's going to this thing. Okay, so there's a high risk of the child being infected.
All right, let's quickly look at how self-medication in this regard.
Okay.
Yes, to what extent can it help or make it worse? Self-medication.
Okay, so in terms of treatment of monkeypox,
yes, because most of the time, it has some similarities with other diseases. So some people just say, okay, I should go to the pharmacist and they will prescribe something and all of that. So where we do not have professionals involved in this case, do you think it can bring about or make it worse if the right drugs are not prescribed or the right diagnosis is not done?
So, like I said, there's no one set thing. There's some antiviral medications that can be used, the ones that were previously developed for smallpox.
Okay.
Smallpox is believed to be eradicated now.
Yes.
But first of all, immunization, people who are immunized against smallpox, they tend to fare better with monkeypox. But we've stopped immunizing. Countries have stopped over 40 years immunizing against smallpox. Okay, so we have those medication. Aside that, the main focus will be boosting your immune system. So eating well, drinking lots of water, taking your good antioxidants, vitamin C, sources of vitamin C, vitamin E, fruits and vegetables, things like that. Okay, the problem now is that there are opportunists in this world. So there are people that will see, this fear of monkeypox, they will start creating all these elixirs and all this. Some of them might have alcohol.
Some
you want to put
solutions,
alcohol on that burn, make it worse. Some people will take some things that will affect their kidneys, affect their liver, just for the fear you do more harm.
What you have to say?
Exactly. Okay, so there's no specific treatment yet, but first of all, when you get to the hospital, they treat you for the body pain, they treat you for your fever, but what we're trying to even ask, maybe the federal government can even bring back the smallpox vaccines or the treatments, because then I think smallpox vaccine treatment was T-pox, where they used that to treat the smallpox, and the similarities are very, very close to monkeypox. So it makes sense because I know in Canada they have T-pox already, right? And there's also a drug that is used for treatment of AIDS patients, because when you have monkeypox, your immune system has dropped. So, and AIDS patients are like the ones that are very, very prone to getting monkeypox because they have low immunity, or breastfeeding mothers, as she said, pregnant mothers, and children below 12 years old. They are they're at very high risk of getting monkeypox.
All right, we're still talking about monkeypox this afternoon. You can send a message to the numbers showing on your screen. Let's see what questions you have for us so that we can talk about it. And there's this virus we talked about during that break. We went on that Marburg virus, which is quite similar. Now, we've been able to conquer Ebola and Lassa fever, and sometimes this Lassa fever, you get the announcement that in some states it's coming up again. Why is that? You're a public health specialist. Why is that? Why does it happen?
As we said, the major carriers are rats, rodents, and Nigeria is not set to be. You can visibly see it. Nigeria is a dirty country. Nigeria is very flawed, not reinforced.
You don't want to say that.
Okay,
because some parts of Nigeria.
I do agree.
A lot of persons may disagree with you.
Wow.
You may be talking based on where you see.
No, where I see.
Yes, you live in Lagos.
Lagos. I'm a public health specialist. I'm a field epidemiologist. I've traveled to about 28 states in Nigeria. So I've seen. And I go to the rural areas mostly. I've seen the drainage systems.
Your submission is based on the rural areas.
No, we go to both the rural, the urban areas. You understand? So I see all of these things. I don't even say where they.
Okay, in Lagos, have you been to Ajaleki?
Of course. I just went there yesterday.
Okay, but most people will disagree with you that Nigeria is not a dirty country, or that Nigeria is a dirty country, so to speak. Yes, and I don't want us to have that mindset that Nigeria is a dirty country, so that a lot of persons will not tag us.
Okay,
if Nigeria is a dirty country, so invariably, people living in Nigeria, are they dirty? You want to say they are dirty too?
Sure. That's the vast majority.
Okay, so you were talking about rodents. So does it mean if we cannot get rid of rats, we can never get rid of Lassa fever?
I think so, because rats are everywhere in our houses, in the drainage systems, in the bins. So it will take a lot to completely get rid of it. But we can get there.
All right. The other time I was talking about the Marburg virus now that has some similarities with Ebola. What's your take on that?
So this Marburg virus, a lot of people don't know about it yet. It's just coming in
yes. In fact, the report has it that Marburg virus is in some West African countries, very close to Nigeria.
Yes.
But as it is now, we do not have any report about Marburg virus in Nigeria. So how do we prevent that kind of virus from getting into the country?
I think it's similar.
And you know how deadly it was the other time?
Ebola, yes.
And say the number of lives it claimed at that time. So how can we prevent such?
Similar to what we did during Ebola, and we did a great job at that time. So there are some confirmed cases in Ghana, like we previously discussed, in 2 cases at the last time I spoke. One thing that would have helped them from making that a lot worse is knowing how the disease presents, which is why anytime I come here, I always try to explain how the disease will progress, how we will look on a person immediately, how we will look at a person a week from now, and so on and so forth. So understanding what that Marburg is about is also hemorrhagic. So it's a bloody virus. Okay, people can be bleeding through their nostrils, through any opening at all, right? And they can have what they call cranial nerve system implications. So people can have seizures, people can have, they start acting a bit abnormal, or they have a very high fever, things like that. So when you know about how a disease is, especially viruses, a lot of them are very similar. So once you know how they present, you can now categorize them and now carry out the necessary protocols on time.
All right. As a public health specialist, how would you rate the performance of NCDC in Nigeria, talking about disease control?
Okay, NCDC is doing a really great job.
Okay.
Because as soon as they hear about any case, they put out the information, they sensitize people, they go to the marketplaces, to rural places that a lot of people do not even know exist. They go there to try to sensitize people. So I think NCD is doing a very, very great job.
You want to agree with that, Doctor?
Yes, I agree. They have a good spread. They even send text messages. You remember during COVID, they will, remind you about this and this and this. They will tell you the areas where it's most prevalent. They will tell you preventive measures, reminders, things like that. That's really amazing, because Nigeria is a very populated place. When you have population, disease control becomes a lot harder. So kudos to them, actually.
All right. Okay. We will go on a break shortly, but before then, there's a need for us to talk about misconceptions of monkeypox, but then you've been able to talk about monkeypox and some other diseases, the similarities, as it were. But then let's look at the belief system of people. COVID-19 was a kind of disease that held everybody at the jugular, so to speak, and people, did what they were supposed to do, so to speak. But this time around, the fact that some people believe that this has not gone haywire, so to speak, it has not really gone wild. What do you think the minds of Nigerians will look like talking about this monkeypox? In fact, as we speak now, by the time we show you the Vox Pop, people on the street talked about their opinions about this monkeypox, if they've heard it before and all of that, and what should be done. So my question is, belief system, to what extent can it affect disease control, especially something like this monkeypox?
Yes. Religion is a very, very powerful agent when it comes to healthcare. I know how many people that will tell, oh, look, oh, you have diabetes, oh, look, oh, your BP, you have hypertension. I have confirmed it with tests, I have confirmed it by checking it repeatedly, and they will say, no, God forbid, God has said no, says no. Oh, I went to my pastor, he said, no, it's just malaria. And they will go, and they will come back when there is a complication with their kidney or their liver or whatnot. So, in addition to sensitizing the people, we also have to sensitize the leaders, the religious leaders. Right? Some of them are doing a great job, but some of them are being very irresponsible. Okay? A lot of people, by the time, if they say, oh, the world is flat, now, there are some congregations that they will just take it up. So why can't they educate themselves on monkeypox and the risk factors and tell their congregation, look, oh, there's a time where COVID was the way monkeypox was, where it was only 200 cases, where it was only this. If we don't stop it now, it will become another series of lockdowns. Pandemic. Let's not let it get there. That's all. 1 minute in one service, and you've affected so many people, right? So it's about getting them to be more responsible with educating and saving the lives of their people, because it can actually save lives.
All right, let's look at the cultural preferences, cultural affiliations people have about all of these things, apart from religion. We have the cultural part of it. You have been to different states, so to speak, as a result of what you do. What is your take? When you meet people, patients, so to speak, how do they react with, by the time you try to inform them, sensitize them about all of these diseases?
Yes, there's some people that take it well, especially mothers. They take it very, very personal. But there's some mothers that, they say the head of the household will not allow them let their children accept some vaccines or go for treatment for certain things. So that fear of the head of the household does not allow some women make their children get vaccinated. But okay, monkeypox, one person can infect like 6 to 9 people at a time. So it's very fast. So people need to take preventive measures.
All right, this question I have for you is about monkeypox and death. As it is, do you see monkeypox leading to death?
Well, as of now, the fatality rate worldwide is about 0 to 11%. That means 0 to 11% of people that get the disease will die. Okay. In Nigeria, West African countries about 3 to 6%. Nigeria is about 3%, which is considerably low. But if we see, look at COVID now. Look at how rapidly the infection just progressed. It just takes that one moment, that one person that goes to that one overpopulated place at the wrong time, or goes to one big festival at the wrong time, and boom.
What do you have to say to people who have monkeys as pets right now? What do you have to say to them? Maybe we should hold that thought and go on this break. To see what we have in the world of sport about the Commonwealth Games, the performance of the male athletes. And of course, right after that, we will see what people had to say about this discussion on the street. We'll be back. Please go away.
The head coach of the Athletics Federation of Nigeria, AFN, Sega Popening, has blamed the dwindling performance of the nation's men in recent international competitions, including the World Athletics Championships at Oregon, US, and the just concluded Commonwealth Games in Birmingham, England, on stakeholders' refusal to deploy science in athletes' identification, growth, and development. Team Nigeria made big headlines at Oregon through the efforts of world record breaker hurdler Tobi Amusha and long jumper Ese Brume, who won gold and silver respectively on the last day of the competition after all the male athletes had fizzled out. And at the Birmingham 2022 Commonwealth Games, which ended on August 8, Nigeria recorded her best performance ever, winning 12 gold, 9 silver and 14 bronze medals. Women won all gold medals. He said, sadly, only the University of Port Harcourt and Delta State utilizes this scientific training center, and the results speak for itself. Athletes like Favour Philly, Grace Wokocha, Praise Idamoju, Divine Ojujuru, Raymond Ekibo, Favor Ash and Gosombrome, among others, as some products of the center, with more in their developmental stages. Competition is keener and have always been keen among the male gender, in which failure of upscaling the management system has now manifested among Nigerian males, not only in track and field events, but also across all sports. Moving along with the prevailing economic and social changes in the country today, the male child is more affected or targeted. For Nigeria's male athletes to meet the challenges posed by their female counterparts, Pobeni said there is urgent need for us to have an understanding of sustainable sports development, particularly the aspects of athletes' discovery, nurturing, growth and development. A former director of sports in Delta State, he said Nigeria needed to change the paradigm in the matter of training requirements. Without prejudice, trainable athletes in the sprints, jumps are mostly found in the southwest and parts of the south-south that used to be the Midwest, namely Edo and Delta, inclusive of states like Ogun, Ondo, Ekiti, Osun, and cosmopolitan Lagos. There are bound good male athletes with very high potential of becoming champions in no distant period, and particularly for Paris 2024 Olympic Games. Don't forget that trainability in the sprints and jumps is just 30%, as the major factor is naturally endowed with the fast-twitch muscle fibers. Others are proper nutrition, athletes' physiological build-up, and the athlete's environment. I will recommend that the athlete's welfare and challenge be revisited with a view to commencing swim for the good of track and field.
My name is Virginia Elvis Omoboje.
Well, I just said about it. Actually, I do not know much about it, but I think it's, it leaves some patches on the body. Yes, definitely. Just like when COVID-19 came out, there was much sensitization about that. People were very, very mindful and cautious of the way they live their life then. But I think this monkeypox is being trivialized. Nobody cares. You understand? No adequate information on it. No sensitization has been done. I do not think there has been any sensitization. The government should, sensitize people, put out information about it, and let people be aware this thing could be deadly and real, just like COVID-19.
Well, it's a breakout. I wouldn't say it's a virus, but it's a breakout that recently, happened, just like that of Ebola. And of course, it still boils down to hygiene, taking us back to where we started from, waste management and all of those things. So if we keep our environment clean, if we make sure that we observe our hygiene duties, I think a whole lot of these things will be bygone in no time. Some of us, because we work in an environment where information are being disseminated as it broke out or as it breaks out, we are opportune to know some of these things beyond, the news and all of that. So I think the media houses should do more. The effectiveness that was employed during Ebola was top-notch. The same with COVID-19. So I think these other, breakouts too should have the same kind of sensitization and, of course, information dissemination, so that people can be aware, and of course they know the responsibility that is, that they are responsible for.
I've not heard about Marburg. I heard about monkeypox, maybe in Edo State or so. As of the COVID-19 this thing, at least they put more information out there. Clean your hand, wash your hand, use nose mask and everything. So the actual thing I know is that for them to curtail the disease, they have to be, they have to be ICDC, or what do they call them? NCDC, so that they can curtail the disease, the spread of the disease.
My name is Virginia Elvis Omoboje.
All right, that's it. You've heard people on the street talking about monkeypox. Some of them said they haven't heard about this before. They're talking about sensitization. What's your take on that?
Okay. I think with time, people would start knowing about it. As she said before, do your own personal assignments. As you hear about certain diseases, go online. It's can find it anywhere. Sometimes I'm using my phone, NCDC pops up something on my screen that you're getting free 50 MB from blah blah blah. So like when you see something like that, you should be automatically pushed to go and check out what's NCDC doing at the time and stuff. So that's how you know about monkeypox. And for people that do not have smartphones, because not everybody that has smartphones,
that's true.
At least they should listen to the news. Like now we're on news, we're on air.
And that's exactly what we're doing on this program. We try to sensitize people, give them information about what they do not know, and of course see how we can add value to the society. Dr. Chichi.
Yeah, so I agree with her. It's just sensitization.
All right, the other time we were talking about people who have monkeys as pets. What is your take? You're laughing about this.
My take is
considering the fact that it's psychological, it has this attachment. Yes, you have this. Some people can do without their pets. Yes,
I understand. Like now, I have dogs. I love them so much.
Wow.
So I can understand if people that have monkeys, because the problem with monkeys is they jump up and down. They can stray away. Yes. They can stray away and do a lot of things. Then they come back. You don't know where they've gone to. So that's when vaccination comes into play. You should take them to the vets very often to get checked.
All right. You want to add something, Doctor?
Yes, just a similar thing. Just vaccinate them and feed them well so their immune system is good. If they're already away from the area where it's likely to be prevalent, then they're likely.
Well, most people try to run away from vet doctors who can actually help. Can you vaccinate them yourself? I don't think you can. Not as a doctor. But you need a vet doctor. You need a vet doctor to do that. So some people who have pets like that, they still do not want to go to consult vet doctors to help them out. So they just give them whatever they like. What's your advice for people like that?
Go to your vet. They're not that expensive. Okay? I was discussing with her during the break, and she said that you can get vaccinated for 3,000. Your pets can get vaccinated for 3,000. Register with a vet, you get a card, they will call you, okay, you're due for this vaccine, you're due for this vaccine, give your pet this, don't give your pet this. Simple instruction, and it will save you so much.
But some people, the reason they have pets is to deal with rats. Take for instance, cats. So people like that may not even bother about going to any vet doctor because they are not ready to spend any money. Yes, they have them as tools. And even if you have tools, you should service those tools, so to speak. What do you have to say to that?
It's about being watchful. You can't just say that, no harm, no foul, what I'm not saying. If it comes to you, by the time you find out that you're infected, you are already infected. So now that we know that something like this is going about, watch your pets. Vaccinate them, even if it's just for a period of time until this goes down. Just make sure that we are preventing your household from being affected.
Okay, fantastic. All right, we've been talking about monkeypox, the causes, the symptoms, the signs. You need to note what you need to do to prevent yourself or protect yourself from this disease. Not just yourself, you, your pet, your family members. In fact, you want to consider pets as part of the family, isn't it? Okay, that's interesting. So before we go, what's your parting shot? What do you have to say to the NCDC, the government, and of course other organizations that are trying to help to see that things like this don't get worse? What's your take? Your advice for them?
My advice for people in general: watch your health, go to the doctor often, eat right, take supplements, take multivitamins, know when to see your doctor, your appointments. If you're diabetic, be very conscious. If you have little children that go to school, very conscious of what they take and what they eat. And NCDC, thank you very much. You're doing a great job. To federal government, thank you. WHO is doing a fantastic job by putting a lot of information out there so people are aware of what to do and what not to do about their health.
All right. Dr. Chichi.
So it's prevention. Okay? Know the things that are going on, the diseases that are prevalent at each moment in time. Get checked, like she said. Eat right. Exercise. And just be vigilant. If you do all those things, he'll be fine most of the time.
All right, this is where we have to draw the curtains. I want to appreciate my guests for coming on the show.
Thank you.
Thank you so much for coming.
Thank you very much.
All right, I've been speaking with Toluwalugo Oshotokun, a public health specialist, and Chidinma Nwokoro, popularly called Dr. Chichi. We've been talking about monkeypox. I want you to join us next week, same time, same station. We'll be doing this again when we bring you more interesting issues on the table. Thank you so much for being there. This is your viewpoint, and it will be back again next week. I am Rotimi Akinzade. Do have a wonderful time.